Pterygium. This is a degenerative condition with triangular encroachment of the conjunctiva on the cornea. It is caused by environmental factors like ultraviolet light, dust, and wind. Pterygium occurs in the interpalpebral fissure nasally. There is senile elastosis of collagen with hyalinization and basophilia, loss of Bowman's membrane, and overlying epithelial dysplasia. Calcific band keratopathy. Calcification of Bowman's and anterior stroma secondary to dystrophic calcification in response to ocular inflammation as in trauma, chronic keratitis, Still's disease, sarcoidosis, and chronic glaucoma. Systemic disease. Metastatic calcification of abnormal Bowman's membrane in hypercalcemic status, as in vitamin D intoxication, Fanconi syndrome, myotonic dystrophy, hypophosphatemia, as in milk alkali syndrome. Rarely, familial, gout, or ichthyosis. In calcific band keratopathy, calcification forms in interpalpebral cornea. Begins at limbus with clear zone in between. Holes correspond to the site of passage of corneal nerves through Bowman's layer. Calcium is seen as basophilic granules in Bowman's membrane and is related to abnormal epithelial activity. Chronic actinic keratopathy, Labrador keratopathy, elastic degeneration. Yellow oil droplet or hairline deposits in superficial corneal stroma. This is a bilateral condition caused by chronic ultraviolet light damage. There is elastotic collagen degeneration, round, drop-like deposits of amorphous hyaline, mildly basophilic material. It stains positive with Verhoeven van Gieson elastic stain, and is autofluorescent to ultraviolet light. Labrador keratopathy may be primary as a degenerative condition related to aging, or secondary to herpetic keratitis, lattice dystrophy, or calcific band keratopathy. Salzmann's nodular degeneration, whitish focal moons of subepithelial hyaline connective tissue, as a reactive process following trauma or keratitis. Bowman's membrane is destroyed, massive focal degenerative pannus. Lipid keratopathy, secondary lipid deposition in heavily vascularized stroma, unilateral or bilateral, follows corneal vascularization and all trauma. Pathology, lipid deposition in thick pannus between Bowman's membrane and epithelium. Corneal keloid, massive scarring and thickening of stroma by irregular collagen bundles. Could be congenital, intrauterine infection, or caused by trauma. Pathology, irregular collagen replacing corneal stroma, corneal vascularization, and epidermalization is common. Corneal staphyloma. This is a condition that occurs where an atrophic iris adheres to the posterior surface of a massively thickened cornea. Keratoconjunctivitis sicca. This is deficient tears or mucus production. Sjogren's syndrome, a triad of keratoconjunctivitis sicca, xerostomia, and rheumatoid arthritis. Lymphoepithelial lesion of Godwin. Lacrimal gland infiltrated with lymphocytes with persistent myoepithelial islands. Lymphoma develops in 10% of cases. There is corneal drying, superficial punctate keratopathy, and filamentary keratitis, detached strands of epithelium and mucus. Xerophthalmia is disturbed corneal nutrition due to hypovitaminosis A. It is caused by severe malnutrition, as in hypovitaminosis A in malnourished children and chronic alcoholism. Also could be caused by Corynebacterium xerosus. In xerophthalmia, the following occurs. Beaded spots, localized keratomalacia occurring at the limbus due to vitamin A deficiency. Corneal epithelial keratinization, epidermalization, keratomalacia, and perforation. DEL, focal area of stromal dehydration and thinning, central to elevated limbal lesion, inducing interruption in tear film. There is partial or full thickness epithelial defect with underlying dehydrated stromal tissue. Neurotrophic keratopathy or neuroparalytic keratopathy. This is affection of lower third of the cornea due to sensory loss. There is chronic progressive lesion of ophthalmic division of trigeminal nerve. Lost corneal sensation with corneal epithelial desquamation. And secondary infection induces perforation. Ectatic corneal dystrophy. Keratoconus. Keratoconus is ectatic condition affecting central cornea. Keratoconus is a bilateral condition whose onset is around puberty and is hereditary questionable, dominant and recessive traits. It is caused by abnormality in extracellular matrix and defect in tissue metalloproteinase inhibitors. There is association with collagen anomalies as in Down syndrome, atopic dermatitis, Ehlers-Danlos syndrome, Marfan's syndrome, Leber's congenital amaurosis, floppy mitral valve syndrome, and aniridia. The following occurs in keratoconus: central stromal thinning and ectasia, dehiscences in Bowman's membrane, and stromal folds. There is also Vogt's vertical lines in stroma and ruptures in central portion of Descemet's membrane. In keratoconus, acute hydrops may occur, which is sudden onset of severe central corneal edema and is common in Down syndrome. Fleshy ring surrounds the cone, iron in epithelium, while the apex of the cone is inferior and nasal to the center of the cornea. Pellucid degeneration. This is a bilateral, progressive, non-inflammatory, inferior peripheral thinning of the cornea with resultant conical protrusion and high against the rule astigmatism. There is inferior corneal thinning 1 mm from the limbus, ectasia of cornea above thinning, intact epithelium, and hydrops is possible. Keratoglobus is bilateral globular configuration of the cornea. There is stromal thinning which is diffuse from limbus to limbus and more marked at periphery.